Can you please tell us a little bit about your current research?
I've always been interested in early diagnosis. So, like I said, early diagnosis prevents joint damage. And so why do some people get disease and why some do not? Now with psoriatic arthritis, in almost 90% of the population, the psoriasis, the skin disease comes first, and then the arthritis. And so there's a captive population of 2 to 3% of the world who are at risk of this arthritis. And so for studying early events in the onset of arthritis, it's a good human model. So my mechanistic interest brought me to this disease where if I have to figure out the onset of disease, say rheumatoid arthritis, then I'd have to look at the general population and maybe look at family history as the only risk factor. Whereas here you had, in addition to family history, you have 2-3% of the population, not the 100%, who have the skin disease first and then the arthritis. So then if you could study those early mechanisms and then look at how to prevent it. A lot of patients have aches and pains and back pain and joint pain, but is it just normal or is it inflammatory? So is there a test that you can do to figure out if you're actually having arthritis now? So those biomarker based tests where the next things in parallel we have been working on coming up with that panel of markers that hopefully can be tested. We have about 20 markers that we're working on now and trying to narrow it down to a panel that would help in diagnosis. It's a heterogeneous disease, so it's not going to be 1 or 2 markers. It's going to be a panel that, depending on maybe your age, your metabolic and other status, you'll have to figure out what works better than the other. So it's a very translational research program trying to figure out is somebody going to get the disease? Do they have the disease at the moment? And then once you have it, what is the prognosis? So I'm particularly interested in the severe form of arthritis, where you have destruction of your joints called arthritis mutilans. So why do some people get that? Is that all due to inflammation, or there's also a biomechanical reason that joints that are under more stress, say if I'm walking or using, are more likely to get that kind of severe damage? And are there any genetic or other risk factors for that? And so that's one aspect of the disease. And then from a mechanistic viewpoint, we look at cells in the joint fluid and to see if how they are different from other forms of arthritis, and is there something that we can do to intervene. So those are the things that I've been doing at my lab, mainly genomic studies, so looking at the gene sequence, and then looking at the protein expression in the synovial fluid and the metabolites in the blood and the synovial fluid and its relationship with how active the disease is. And hopefully what we're also trying to find out is, based on this, could we predict which drug is going to work better so that we don't have to do a trial and error thing that we do nowadays, but say based on this parameters, this profile, this drug is better for you than the other drugs. So all this comes under the realm of translational medicine as well as precision medicine. So we're trying to tailor that to the individual patient.